If you have a patient that is experiencing sudden crushing chest pain, you can administer nitroglycerin. That will be found here in Dr. Dean's office in our first aid kit. What you'll do is you'll grab one tablet from the prescription bottle. You'll place that under the patient's tongue. You'll then wait for 5 minutes. If the patient is still experiencing that chest pain, you can administer another tablet. Wait another 5 minutes, and you can administer up to 3 tablets. If the patient is still experiencing chest pain, you can call 911. If you have a patient who is experiencing anaphylactic shock, meaning their airway is closing due to a severe allergy, you'll want to administer an Epipen. An Epipen will be found in our UCDH first aid kit in this box. When you open the box, you will find that there are 2 active EpiPens and 1 practice pen. If your patient is having an episode, you will want to use the active pens. We're going to demonstrate on the practice pen. So you'll follow the instructions. You're going to twist the cap off. You're going to pop off the blue cover, and you are going to use pressure into their thigh and hold for 10 seconds.
1.
If you have a patient that has passed out, first you'll want to check for a pulse and breathing. If they have a pulse and they are breathing, you can use ammonia to help wake them up. The ammonia will be found in our UCDH first aid kit. You'll grab a little pouch and you'll go ahead and crack it almost like a glow stick, and then you'll hold it about 4 inches underneath their nose until they wake up. If your patient is experiencing insulin shock or hypoglycemia, they might have symptoms like being clammy, cold, pale, or have a forceful heartbeat. If your patient is diabetic, they will let you know this. If they start feeling this way, you might need to administer glucose to them. We have that here in our UCDH first aid kit. Our tubes of glucose have 15 grams of sugar in them, which is enough to help for someone who has low blood sugar. Your patient should consume this entire tube. Then you'll monitor them for 15 minutes. If they're still having symptoms, you can administer 1 more tube. After 15 minutes, if they're still having symptoms, we will need to call 911. If your patient is experiencing an allergic reaction that is not as severe as anaphylaxis, some symptoms may include itching, rash, or hives. You can administer them Benadryl, which we can find in our UCDH first aid kit. We have tablets for adults, we have liquid for children, and we have a Benadryl cream. You'll want to use the dosage on the back of the box and follow it for the age of your patient.
1.
If your patient is unconscious and they do not have a pulse and they are not breathing, you'll start CPR and ask someone to call 911 and get you the AED. Our AED is located here in the hallway. To access our AED, it says to turn the key. You don't have to do that. You can just go ahead and open the cabinet. Inside, this is the actual AED. It comes with the adult size pads, and if you have a child patient, there's the child pads as well. Inside the cabinet, you'll find a razor. You'll use this if your patient has hair in the area we need to place the AED pads. You can shave it off. And scissors to cut off their shirt if needed. That's it. After you've been asked to grab an AED, you'll want to grab everything in this cabinet as you don't know what exactly the patient might need. When you get to the patient, if you need to switch out the pads, you can do so by pulling up on the cord, unplugging it, and plugging in whichever set fits your patient's needs. After that, you can go ahead and turn the AED on. You'll want to make sure that the patient is not wet and there's no water nearby. Once you turn the AED on, it will guide you through all of the steps to move forward. It's going to be very loud, so just beware.
Call for help. Remove pads from package in back of unit. Apply pads to patient's bare chest as shown.
If your patient is experiencing a medical emergency but is still breathing, you can administer supplemental oxygen. To use the supplemental oxygen, you will grab the oxygen tank from Dr. Dean's office, and you will start by placing the mask over the patient's face. Once it's secured onto the patient's face, you'll turn the handle counterclockwise and you will open the oxygen tank. Then you will monitor the patient's breathing, and if they stop breathing, you will then move on to positive pressure oxygen.
1.
If your patient is experiencing a medical emergency and is not breathing but does have a pulse, you can administer positive pressure oxygen to them. To do so, you'll start out by getting your oxygen tank here in Dr. Dean's office. We're going to remove the tube from the face mask, and then we are going to connect it to this side of the positive pressure bag. Once that's connected, we will go ahead and open our oxygen tank so that the air is flowing. You'll want to secure the face mask around the patient's face. You might need to ask a friend to help you hold this down so that there is a tight seal. Then you will start compressions. You'll want to push the bag in every 5 to 6 seconds for an adult and every 3 seconds for a child. If the patient is still not breathing, you'll want to check for any obstruction and you'll want to go ahead and call 911.